Hello, everybody, and thank you for joining us today. We have Dr. José Perea, we have Amy Delores. I thank you guys for joining us as well to have this discussion. The three of us put together a publication that, I think was very well received, and it was interesting because it was a true collaboration of the scientific community as well as patient advocacy coming together. It's called Lights and Shadows in the Early-Onset Colorectal Cancer Management and Research, an Integrative Perspective, physician scientists with patient advocates. Let's begin by talking about why we came together. I think that it was really important that we put together something that came from the scientific community as well as the patient world, because a lot of times we don't see this level of collaboration, and we really went back and forth quite a bit when we put this together to talk about the interesting and important elements on both sides. So, I'd love for you guys to share your insights and thoughts on what it was like to come together in this.
The idea was thinking about all the summaries, all the reviews that were being published in the literature about early onset colorectal cancer was almost not the same direction, but also in focusing specifically in different topics, but almost the same. But I think early onset colorectal cancer is a problem that must be faced by all the sides of the problems. And thinking about that, I think we should put together not only researchers, but also clinicians, but also patients, because all of us, I think, have got different ideas, different knowledge, but also how to move forward. About the needs of this problem is different, and putting together all in a whole work, I think it was going to be not only interesting but also essential, and I think it has been done like that.
Yeah, I think it was really important for me that you embraced us as peers in this publication. It did not feel like you were just coming to us to say, checkbox, I had a patient on this and now I can put it out. I really felt like the things that we talked about were really important to us, and it was incorporated. And so I think that for researchers that are interested in putting together publications or studies or anything like that, to involve the patient advocates at the very beginning is really helpful and influential in how things shape in the outcomes, and also in the distribution of it getting into the patient community. And to that, I'd like to kind of talk about the global approach a little bit, and ask, why is a dedicated global approach for research so important? Dr. Perea, you've been really involved in the global output, not just within your own country, but reaching across the pond, so to speak, and really making sure that we are all collaborating. So would love for you to talk about your approach and why it's so important to you.
Yes, I think in that regards, thinking about early onset colorectal cancer, maybe a few years ago, it was something that it was beginning in being a problem in USA. But nowadays, we know that this is a global problem, first of all, but also we have seen that the incidence is increasing, but differentially. Then some studies have been shown that phenotypes maybe are different, not only about geographical areas, but also according to races, according to gender. So thinking about that, I think these problems should be faced in a global approach too. Because if we, for example, study, from my point of view of researcher, then if you study this problem specifically in one population, then you are losing things of the whole problem. So that's why I think it should be studied globally.
And Annie, I know that you actually communicate with a lot of patients, not just in the US, but everywhere else. Is there anything that you've heard come up from the patient community in terms of this global approach and research, and anything like that you've encountered?
I think, going back to what Dr. Perea was saying, it's like, I remember early research talked about how there was a higher rate in Egyptians. And then there's also been research that even people who are vegetarian in India were still getting colorectal cancer. So I think the global uh, aspect of this is fascinating in that there's so many things that we can find out. I know that MSKCC, I believe, did research looking at people who were from Africa versus people who lived in the US who had a similar ethnic background. And it's so important to figure out what is going on in the environment, because it's hard to figure out why, but it helps to know why if you have more data from more sources, and that it's not just Western population. There's people who do well.
Yeah, and I think that goes to what I would ask next, which is what you want the global community to consider in research. And as we more and more across populations and countries and interact and move around, I think that the needs assessments changes over time, as well as with the rise in early onset colorectal cancer. Just there's so much change, and it rapidly is occurring, and we need to consider the cultural racial components of how that impacts the screening and detection rates, as well as the treatments that result from that, because with the different phenotypes that we have, that may impact what works best for different races, and so we really have to take those things into consideration as we conduct the research. And certainly I know one of the difficulties that clinicians have encountered with clinical trials is the disparities in enrollment. Just not having enough of a variation in people who are enrolling to make sure that all the different populations are being represented, so that we can really test to see the benefits of these new drugs and therapies.
No, and I think thinking about in the same direction, if you want to do a very well and complete research about the whole problem, you have to keep in mind that these studies should be made within collaborative approaches. I mean, you have to take different centers, but not only in the same country, but also as well in different continents. Trying to cover all those problems about the disparities regarding races, etc. Because if not, you are maybe saying, okay, this marker is very well, but then you think that is very well in the whole world, but you started to use it in USA or, for example, in Spain, and then everybody thinks that's the gold standard, and then thinking about the disparities, then you started in another country, and then wouldn't work. So thinking about that, I think early onset colorectal cancer, and then also the approach to put together research, clinician, and patient advocacy, it's essential, because I think that will cover this issue.
When we look at the global research, we have to make sure that the early age component is included in this, because we have a population here where what we do now is really going to impact the rest of our lives. And so these late stage effects for the long-term survivors really have to be taken into consideration.
If I write down only for my own or with my colleagues, then that manuscript will reach maybe the scientific population. That's it. But if we put together in the same work, researchers, clinician, patients advocacies, then, for example, the message that maybe I would like to give, then being because of you are involved in it, then because we used a language that I think it's understood by everybody, then we'll reach more people. And I think that's, in my opinion, one of the most important thing that this work could have. Just an example, but about maybe in the future we'll have more manuscripts in the same direction and the same type of manuscripts. That would be fantastic.
And we are starting to see posters show up at big conferences like ASCO that are based from patients and patient communities. And that made my heart so happy, because it really means that we're being accepted as experts as well. And I know that sometimes patients walk into some research settings and feel like, well, I don't know anything, I'm not a doctor, but that's not true. As patients, we actually learn a lot, and our experience counts for a lot. There are things that we go through that the research community doesn't know about, that needs to be expressed in this research. And that's another level of why it's so important for us to collaborate together. You know, for me personally, I would advise researchers who are looking to expand and really deepen and enrich in their research to go to the advocacy organizations like Fight CRC that have these resources, that have the advocates that can really jump in and have deep, meaningful impact, to include them from the very beginning of your talks, your ideas, even before you submit for grants for funding. Like just start having that conversation to see what might I be missing, or how can I include to make sure that every aspect is included. Like that would be my advice. I'm deeply encouraged by Fight CRC's early onset think tanks, because I think that it really is a convener of all the different stakeholders to really bring together the different components that we need to move the needle forward, to resolve some of the issues that have been longstanding, to find the answers that have been plaguing us. You know, why is this happening? Why do we have this increase in early onset colorectal cancers all across the globe? You know, I think that the group that we are bringing together are best of the best. We continue to, you know, add different people. We are just bringing together all the stakeholders. And I think that it's really important for us to continue to do that and to continue these conversations. I really look forward to our in-person in Barcelona next year, but you know, in the meanwhile, we have the virtual think tanks that are happening this year. So I hope everybody continues to join these conversations. Dr. Perea, Annie, thank you so much for giving your insights and for your continued collaborations and efforts. We really do appreciate it.
No, thank you. For me, it's a pleasure and an honor to be part of this great effort. And of course, again, a global effort of not only around the world, but also putting together all the people that we are involved in the problem. I think that's the point.
Thank you for setting this up, Phuong, and I'm looking forward to having people, you know, maybe check out the paper and think about the things that we all brought up.
All right, everybody. Thank you so much.